meeting wa rena ne go na le di-channel ge o tlhoka toloki emisa letsogo ba o fe toloki ke motšhene o tla lokela channel e o e nyakang. Channel 1 ke English, Sesotho kapa Sepedi ke channel 3, isiZulu or isiXhosa ke channel 4, Tshivenda or Xitsonga ke channel 2. Ga o ja ka toloki emisa letsogo gore ba o fe interpreter. Ya buseletsa English channel 1, Sesotho Sepedi channel 3, isiZulu or isiXhosa channel 4, Tshivenda or Xitsonga channel 2. So ge re starta meeting ke tlo kopa re starteng ka pina ya setšhaba, ke kopa volunteer a starte pina ya setšhaba. And can we distribute all the interpretation to all the people in the meeting who would like to get an interpretation in their preferred language, please? Can I get a volunteer to help us with the singing of the national anthem? A volunteer in the meeting, Aristatele, South African national anthem. Thank you, Mama.
Nkosi sikeleli Afrika, maluphakanyiswe uphondo lwayo, yizwa ithandazo yethu Nkosi sikelela nalusapho lwayo, morena buluka setšhaba sa heso, o fedise dintwa le matshwenyeho, o se boloke setšhaba sa South Africa, a deep blow van onze hemel, a deep van ons hier, war ons Bertes, waar die kranse antwoord gee. Sounds the call to come together and united we shall stand. Let us live and strive for freedom in South Africa, our land.
Re a leboga, re ka dula fatshe. Le kry-ile interpretation. Emisa matsogo gore ba tle go lena. Those who need the interpretation is very helpful because everything will be clear for you. You emisa matsogo, pakamisa izandla, they will come to you and give you the interpretation. Let me take this opportunity to acknowledge the presence of the MEC for Health, Dr. Noma Themba Mokgethi, and the entire team from Department of Health. She will introduce them. My name is Rebecca Di Gamela. I'm the chairperson of the Portfolio Committee of Health in Gauteng. I will also introduce the team that we are going together with. Remember, the role of the portfolio committee is to do oversight on the Department of Health, to do public participation, to do cooperative governance and lawmaking. So those are the duties that we are responsible for in the Department of Health. Please, can you distribute those gadgets? Can you give people in front here? We don't want to miss anybody, please. Can you also bring here in front and this side of the hall, please? So in this meeting, you feel free to speak your languages. Yeah, Rolela, Sotho, Sepedi, Sitsonga, Sizulu, everything. So for now, I just want to recognize among ourselves, our ward councillor of this ward, Councillor Shongwe. Councillor Shongwe up the stage to come and welcome us in their area. Secondly, Snow Inkosi, Yamatungwa, Ukona Ngapakati, we are very blessed because banally interest of what's happening in the Department of Health. We appreciate it very much, sir. Thank you. Bayete. Yeah, so I'm going to now allow the introduction of everyone. Thereafter, the councillor will welcome us.
Dumelang batho ba bagolo, leina la ka ke Mapefo Mogale Letsie, a member of the committee.
Sanibonani, Kamunokwazi Ngidi, committee coordinator committee.
Dumelang, lebitso la ka ke Maggie Mokonoto, researcher ya the portfolio committee.
Sanibonani, Kamala Bongobo, service officer ye committee.
If I am missing, to introduce the people.
Sanibonani bantu abadala. Okhuluma lana nguDr. Nomathemba Mokgedi, uMEC wezempilo lana eGauteng. Ngizocela ukuthi uacting HOD as introduce sino CFO sibe no DDG, acting DDG we hospital services. Ngiyabonga.
Abshin. Minjani?
Ifukile minjani?
Ipfukile. Mina vitora mina imina Basan Baloyi. I'm a DDG Corporate Services Department and today acting as a HOD, and I'll request my colleagues to introduce themselves and those that are on the floor to just stand up and introduce themselves and wave.
Please, Doc, can you just a little bit remove the mask so that they can see you? You will put it back. You can see the man.
Dumela Makhaitso, Absheni, Dimachironi, Molweni, Lochani, Huyamore. Nakin Nafredi Khongwana, I'm the acting DDG in the Department of Health for Hospital Services. Relawakhala Chunu Hualiluna Bakhaitso. Enkosi.
Dumelang bagaetsho, lebitso la ka ke Lerato Majo, CFO ya department ke a leboga.
Sanibonani bantu abadala, ngegama nguKhanada Matsaning. I'm the department's acting chief risk officer. Ngiyabonga.
Locha. It's Langandisandani Kobo. I'm in charge of infrastructure. Thank you.
Good morning. My name is Kwarake Kana. I'm the spokesperson in the office of the MEC.
Morning, Zolela Ngwabe, Director Ikuruleni District, Health District.
Sanibonani, igama lami nguThozani Wakalanga. ngisebenza kwi-Department of Health, ngisebenza ngama-stakeholders, intergovernmental relations in the department. So,
Ra leboha ke nahana hore Department of Health ba bohle they introduce themselves. Ke tlo khupela Councillor Shongwe le yena a re welcome mo plekeng e re leng mo ho yona. Councillor, over to you.
Sanibonani. Lo khulumayo ngaphambi kwenu uNkosinathi waBashongwe, who's the ward councillor for Ward 44 in Vosloorus. Firstly, I would like to greet the MEC, the chairperson of the portfolio committee members, distinguished guests, and all ladies and gentlemen currently present here today. It is a great pleasure to welcome you all in this stakeholder engagement. There is an overwhelming evidence that the quality of healthcare in South Africa has been compromised by various challenges that impact negatively on the healthcare quality. Improvement in quality care means the fewer areas reduced in delays and in care delivery. Improvement in efficiency, increased market, and the lower cost. The decline in quality healthcare has been caused by the public to lose trust in the healthcare system. The healthcare sector includes strategies and employed by the government to improve the quality of health in service delivery. Perhaps, in short, the purpose of this stakeholder engagement session is to discuss the challenges faced by the suppliers who provide services to the Gauteng Department of Health and its hospital facilities. More or less in these few words, I would like to welcome you all. Let us all participate in this sitting, engage especially in the challenges that we are facing as a community of Vosloorus or as a community of Ekurhuleni in general, even though it's a provincial sitting which includes other regions. I thank you.
Thank you. Let's clap hands for our councillor for welcoming us. Re a leboha. I also want to thank you, stakeholders, for putting everything aside. Gore le tle mo, re tle re kgone ho bona hore re ka thusana bjang. A kere ke department ya lena. So you need to be involved ka the issues that department. Ka ntle le ho senya nako. Rena as a committee, we receive a number of complaints from suppliers who sent messages to us as a committee regarding queries or challenges they are experiencing with Gauteng Department of Health. Then we realize it's important to really beat re tle re utlwe hore lena ba bang ba ba sa kgonne go kwala mangwalo lena what are the challenges. So, and there has been also various media reports you have seen regarding shortages in our hospitals, and I'm not sure about the clinics, for the supply of equipment, maybe bread and other stuff. I can really bone. You have seen. So the role of the committee is to go and seek information, and we are not here just to, we are doing something to help the department. But the information from yourselves, little tools, or department identify mo e leng hore e ka krea di loophole e kgone ho di tswalela. Again, like I'm saying, every now and then we receive queries from stakeholders, but not every stakeholder is able to send their query. So that is why really the stakeholders who are suppliers in the department, really for opportunity to raise issues that are affecting you as suppliers in the Department of Health. So, I'm not going to go lolo. The department will do a presentation. Ke kopa, le tshwareng dipene, le kwale, ke tlo le fa chance, le lena, le kgone ho raise the questions. Those who are coming in, ba no tsena silently without making noise. There is still some space on my right-hand side. So, please, this is your meeting. This is opportunity ya lena. Gore le lena le kgone go ipolelela ke re setšhaba sa Vosloorus, setšhaba sa Gauteng go na le batho from various areas in the province, so re a le leboga gore please, this is your opportunity. Ke a leboga. MEC, over to you.
Thank you very much. The CFO will do the presentation. Thanks. Through you.
Thank you, Dr. Hongwana. Dumelang gape bagaetsho. My name is Lerato, like I said. I'm just going to be brief on the presentation. I hope I will be fine when I speak English, and so that we all have an understanding of what I will be talking to. Point number one, we are here to make a presentation on payments that we have processed for the year, and the issue of allocation that was given to the department in terms of the payment plan for the current financial year. We also have a register of accruals, and we'll also be talking to equitable shares, and then how we have performed as a department on the conditional grant. We'll also be looking into the work cycle and how then we are planning as a department to improve on paying suppliers within 30 days. There is, of course, a number of challenges that we are going to talk about in the presentation, but we also have recommendations or advices that we want to give to the community in terms of the improvement process itself. So as I said, we have accruals that we have paid, and accruals in terms of financial accounting terminologies, simplifying it, it means, or it refers to services that were rendered before the 31st of March. As we all know, the financial year government starts on the 1st of April every year, and it ends on the 31st of March the following year. So in that 12-month period, we have a budget that is allocated, but we also have records of how we have spent or performed on that budget. Now, what invoices that we could not process when the year ended on the 31st of March will then be paid as new transactions in the new financial year that is starting on the 1st of April. So for accruals, in terms of services that were rendered before the 31st of March, with invoices received before or as at the 31st of March, we could pay at least 557 million out of what we had recorded at the time, and amounting to 1.7 billion. We took a selection of facilities, and in the main wanted to analyze the works or the services that are rendered by the academic hospitals and the tertiary hospitals, or the secondary hospitals, so to say. Chris Hanibara, Charlotte Mateke, Josh Mukari, and they call it Pretoria Academic, but it's now Steve Biko. Those are the budgets that, or the accruals that were carried through from the previous financial year, and those are the invoices that were paid relating to the service providers. Of course, it is an indication that when the year began, we could not process the whole 1.7 billion because the cash that was available in the bank at that time for that particular month was only 557 million. So it literally now says all these invoices, even though they could not be paid by 31st of March, in the month of April, we could only pay 557 million. On the next slide, we are now reflecting those invoices that were not paid in April and were now processed in the month of May. Again, in May, there may have been invoices that were not recorded in March, but services were received before March. So those invoices would also now be also regarded as accruals. So we then had a summary of transactions that were processed now during the month of May up until the 17th from the first week of May, and those were amounting to 1.3 billion. We also wanted to give an overview or a high-level overview of what has been recorded as accruals for the department and outstanding from the previous financial year of 2021-22 that are carried through into 2022-23. All in all, we are talking of 1.786 billion. That is the sum total of only these facilities. We are not disclosing information that relates to district hospitals or even the clinics as such. But our focal point was now on the 4+3 tertiary and secondary hospitals. So as you can see, we've got invoices that are current that are 15 days and below in the system, amounting to 438 million. And then those that are within 30 days are 446 million. And those that are above 60 days are 276 million. And those that are above 90 days are 624 million. Of course, the plan of the department is to first look into this balance of accruals as it relates to 90 days outstanding invoices. We must take note, colleagues and honorable citizens. The reason why health is in this financial state that it's at is because there are several demands that are made. We are obligated as an organization to then provide healthcare services, despite the fact that people that we care for are either foreign or citizens of the country. Whoever is living in South Africa is entitled to receiving healthcare services. There are those that are payable services, there are those that are free services. But as you look into how we are performing as a country or as Gauteng, we have had a number of, an influx of people residing or coming into Gauteng. I think in the year 2020 and half of 2021, we had plus minus 500,000 people who are inhabitants of Gauteng coming from other provinces and also coming from other countries. Now, the budget, of course, of the Gauteng Health does not necessarily increase to accommodate the influx of migrants in the province, but we have to make use of the little that we have to then make provision for healthcare services. So the demand for service is more than what we can afford in terms of the budget, despite the fact that we cannot therefore send people away because we would claim that we don't have money. Hence, we then have these high balances of accruals carried through from one financial year to another. So the commitment basically is more than the budget allocation of the department. So we are overcommitting because there's high demands of services rendered for demanded healthcare provision within the province. So all in all, we've got 624 million worth of invoices that we could not pay to suppliers because the budget got depleted and we didn't even have cash in the bank. So all in all, we're talking of 1.786 billion worth of accruals that are carried through from the previous financial year. Now, breaking down the 1.7 billion, remember I said 1.786 billion, we also take note of the fact that health receives a baseline allocation which is now split into two. One, we've got conditional grant funding. Two, we also have equitable share funding. So in terms of our own analysis, last year, for an example, we had 59 billion adjusted budget. In the current financial year, we have 59.4 billion allocation when the year began. Now, of this 59 billion, we at least have funding that speaks to conditional grant allocation. Conditional grant all in all amounts to plus minus 14 billion. Of this 14 billion, there are employees or doctor specialists that we recruit and clinical specialists that we also recruit that we pay. using the conditional grant funding. Now, there are also resources that which we procure for, like the HIV/AIDS program is a conditional grant. We also train our doctors and nurses out of the conditional grant. We also have conditional grant that procures health technology equipments. We also have conditional grants that provides additional clinical services and maintenance of facilities. So all in all, when we separate the budget for conditional grant and expenditure for conditional grant, out of the 1.7 billion that I was talking to, we at least have 916 million that now relates to equitable share expenditure. This now is an indication that we've got invoices to the value of 916, that which could not be paid out of the baseline allocation, and this is now not relating to conditional grant, but speaks to the equitable share. Now, on conditional grant spending, we had said the budget is 14.4 billion, and just on COVID-19, we had plus minus 45 million. I think there's just a typing error there. And so far there's about 7.4 million that has been expended already. But of the 14 billion worth of conditional grant in the current financial year, there's now expenditure to the value of 1.2 billion. So if you look into those health facility revitalization grant, national tertiary services grant, and the likes, you will then see that that is now the breakdown of the budget allocation and also the expenditure incurred as at the 20th of May. So all in all, we're talking to 8.4 billion worth of invoices that have already been paid, including salaries of staff members, and this now constitute 8.4% of the overall 14 billion budget. We are left with 13.2 to spend for the entire financial year. Now, we also made a provision for the age analysis in terms of the work cycle. In the work cycle, we've got 5,986 transactions. This now refers to either invoices relating to services or goods that have been rendered for health, and then in the main, the majority of these transactions are 151 days above the norm. Now we've got 2,204, which now indicates that services have been rendered. It's either these invoices have not yet been submitted or received by the department, or the goods received voucher has not been received. So these are suppliers who have rendered services but have not yet been paid on the basis of either non-submission of invoice or either non-submission of goods received vouchers. Now, the challenges that we are facing as an organization in terms of our inability to pay suppliers within 30 days is that majority of our people are not knowledgeable or misinformed, let me say, on the process of capturing invoices on the system. Remember, as government, we had made a decision that we are no longer going to receive invoices that are submitted manually or by hand. Now, all suppliers are supposed to be registered on the system that is called electronic invoice system, that which everyone is supposed to be registered on. Now, for you to be registered on EIS as a system, you need to be also registered on CSD. CSD stands for Central Supplier Database, and this is now a system that is with National Treasury. It will capture all your demographic information and indicate which region you are in and which services you are interested in providing within government. Now, in Gauteng, we have an EIS system that which requires suppliers to submit invoices electronically. This system is intended to fast-track invoice submission and payment processing. Now, when the invoice is submitted electronically, we will then confirm that goods have been received, and we look into the purchase order that is also issued electronically, and then we match the three-way system, and we will then be able to proceed with payment to your invoice. But we find that most of our, especially our black-owned companies, do not necessarily have the knowledge on how to capture invoices on EIS. Not because they don't have the skill, but they find it difficult to follow the process. At the end of the day, the invoice does not reflect on the system, and we now have to take them through that process of saying, the reason why your account is not paid is because you did not register your invoice correctly, or you did not even register the invoice on the system. So it's one of the issues that we've identified as one of the big problems that our small and medium enterprises are unable to do. The second issue is overcommitment. As I said, we have an influx of people in Gauteng who require these healthcare services. Now, sometimes with the money that we have, we cannot afford and we cannot chase people away, but we just have to buy the resources so that, doctors and nurses can then provide the service that is required. If, for instance, there are no bandages in the ward, we cannot chase patients away because there are no bandages. We will make a negotiation with the supplier and say, can you supply? And then we will pay you within 60 days or sometimes within 90 days. So the commitment that we carry from one financial year to another has an impact on our ability as a department to pay suppliers within 30 days. Again, multiple vendor numbers. You find our SMMEs have got multiple businesses. So they will be given different vendor numbers, and every time they go to Treasury and give information that is not the same. I'll give an example of one. You are registered as a company in Vosloorus providing toilet rolls or cleaning material. Now, when you submit your vendor details, the system in Treasury will request you to indicate which street you are staying at. So once you put your street address as 135 Molapo Street, and the next time you put 1 space bar 73 1 space bar 35 Molapo Street, the system records that as a different address. So it will then give you a different vendor number. But you'll find that it's one company that has got 5 different vendor numbers. And for the mere fact that we would not know at the time you submit your invoice as to which vendor number you relate to, it creates unnecessary delays in paying your account because the information you had given is not the same as what you had provided before. So these are some of the issues that we now experience in terms of vendor registration. Again, on a monthly basis, because we've got 59 billion, we are given a certain amount of cash. We cannot just say we will spend the whole 59 billion in 1 month of April. We need to make sure that this money is spent on a monthly basis, and Treasury then gives us a limited allocation for services that we need to procure. Now, on average, the department spends about 500 million just on goods and services for requisitions. Now, because we only have 500 million, you'll find that the commitments that we have made are maybe 700 million. And because we only have 5, we can only pay 5 for that particular month. So these are some of the challenges that which we face because the demand is high, the cash limitation is low, and also there are court cases that would result in the department not being able to settle, legal or cases that we have lost in terms of medical legal challenges. Our doctors sometimes make mistakes when they do operations on our patients, and the state is now being sued. When a patient wins the case, the court gives an instruction that the money must be paid with immediate effect or within 30 days. Sometimes one transaction for one patient will amount to something like 10 million. And when the court has given an instruction that there's 10 million that's supposed to be paid, we cannot say, by the way, we've got suppliers who are supposed to receive something of that 10 million. We have to first prioritize that 10 million and then the money leaves. So if we had 500 million and we've got like 10 of these 10 million transactions that are paid in 1 month, it means then that the budget available or the cash available for that particular month will then be 400 million. So in the true sense of the matter, some of these legal, medical legal cases are costing us not to be able to pay suppliers within 30 days because the cash is taken from the bank long before we can even access it and then pay our suppliers. Again, our suppliers are not knowledgeable when it comes to, or are not informed of the process, let me put it that way. That when you have rendered services, you are supposed to at least give the department a delivery note before you submit your invoice. So for us to confirm that your goods have been rendered, we need to have your delivery note and your invoice and your purchase order at the same time. So most of the time we will find an invoice in the system, we'll find a purchase order in the system, but there will not be a delivery note. So we have to call you only when you make an inquiry. Do we call you and say, oh, okay, the reason why your account is not paid is because you did not submit a delivery note. So we need to have a situation where our suppliers are informed of the process so that we don't cause unnecessary delays. But these are some of the challenges that we are now indicating. Again, our own service providers don't submit invoices on time. And that is now also part of the reason why we cannot pay suppliers within 30 days. You'll find that when you submit the invoice, it's still dated April, but you have submitted it in June, for an example. Because your invoice is dated April, by the time we pay it in June, the system records it as a transaction that we could not pay within 30 days because on the invoice itself, the invoice date is registered as invoice for June. So these are some of the challenges that which we face where invoices are submitted late and the date on the invoice is still dated previous month or something like that. Now the other thing that is really one of the challenges again is the submission of incomplete data on supplier database or contracted suppliers. You'll find our own SMMEs are submitting an invoice that will not necessarily have the VAT amount calculated or the bank detail reflected or even the home address. So these are minor things that which we think our own people needs to know and we need to capacitate them on. So Chairperson, we have got resolutions also. The MEC has requested that we call a meeting with all suppliers so that we can then address these challenges individually. So in the month of June, we will be calling all service providers through public invitation, either through newspapers or radio publication, where you would then need to come in and we discuss problems and how then we can inform you of what you need to do. So we will facilitate a workshop that will upskill our suppliers on how to submit an invoice, how to submit a delivery note, and how then to ensure that when you submit your goods, they are quality and also they would not cause problems when we have to pay you. Again, we will manage procurement in terms of aligning our goods and services with cash available. The one thing that we are really struggling to deal with is when there is a demand for a service, but we know that we will not be able to settle that invoice within 30 days. Let's say, for an example, a doctor now needs to perform an emergency operation because one person had an accident. If there's no sutures or needles on board, we now have to procure those things urgently so that the life of the patient can be saved. Now, the one thing that we want to control is that we don't buy things in bulk. We can never assume that we will need 1,000 bandages, but rather let's buy 100 bandages that which will be used now and then we'll pay so that we can then procure at a later stage. So the procurement process in terms of requisitions or goods that are in demand also needs to be managed from a procurement point of view. We are also going to schedule a meeting with the Gauteng vendor management team so that they can also assist with dealing with addressing challenges that which are vendor management related. Apologies. So the vendor management team will unlock challenges where a supplier has a problem with the information that is registered on the system that disables the organization to pay within 30 days. Again, one of the issues that we will have is to manage procurement of goods and services in order to reduce our monthly commitment. Chairperson, allow me to end here, and that is now what we wanted to present to the public. Thank you.
Thank you very much, CFO. You were listening, ke nahana hore le kopolotse di-notes, ke nako ya lena now ya go botsisa di-question. Now, ba re o tshwanetse ho be le workshop akere ya o thusa lena hore le lokela bjang di invoice ko systemong lena you must ask gore when re ka tla neng ke ra bao ba sa kgoneng go lokela di invoice ko systemong ke a le thusa akere because e ka no e ngwadilwe mola mara a ine time frame mara lena le ka ikhopelela or la suggesta or la butsisa gore when can we come so the time frame di ka le thusa ke bone ba re ba ka organize le Zoom or Teams meeting mara ba bang a ke ra ba bane access a bane airtime so le physical meeting e dumelehile akere le kopane then ba tle le laptop maybe hona ka mo or kae gore le ithute gore le lokela bjang dilo ko systemong a ke re go botlhokwa so nna ke a le thusa mara ke sure maybe lena le sharp le a gona bona stress mara I know ba bang o kry le gore airtime ke problem akere now ke nako ya gore lena presentation a ke re tlile fela ka dilo tsa di service invoice or di le bone topic ya rena akere topic ya rena Gauteng Department of Health challenges faced by suppliers who provide services to the Gauteng Department of Health and its hospital facilities. Mo re bolela ka di lena di service providers mathata a le kopanang le ona le Department of Health ge le tshwanetse le provide di service or post after le provide di service le bone a kere ba bontshitse gore di challenge ke mathata ke eng ke nako ya di question di comment mang le mang o allowed hore a ka raisa letsoho ke le fe di nomoro that is why ke emeletse ka maoto hore ke le bone ke tla thoma ka mo ke mang a nang le a nyakang go bolela something le go khwira something ke tlo tla ka mo go lena mampile e re ke thomeng ka mo le sharp ka mo okay e ko fa number o le 1 o number 1 akere number 1 mo number 2 ko morago ko staging kwa ko ba re keng wa ya ko ke no re ke stage kwa godimo ko le sharp ko ke ra lena ko staging le sharp ne le sharp okay ke tla mo number 3 mama ka ntwe pink number 4 mama ka jacket ya scotch black and white number 5 my sister number 6 my sister ko morago yes 7 come 7 ko morago abuti 7 and 8 abuti next to you ke 8 ne yeah le sharp and then mo number 9 ke tla ka go lena 10 11 le sharp ke 11 akere o tsama le bona akere ke round e re tsamang ka yona no akere ge go na le wa e gopotseng o tla tshwara ka jase re ka se o tloela a re thomeng ka number 1 Isaac o kae ka mike okay
Sharp.
Today ge le ka bolela gore dipetlele kae closing time or visiting hour e tla no ba ile information mara se re tlileng ka yona kere gore ba tswalla ka speed re sana le 20 minutes re sa bona ba di visitors eo a se yo re tlileng ka yona kere re nyaka lena ba ra kgwebo le raising the questions tse le di experiencing or the challenges ne ke kupela re ska bolela re utlweleng question gore ge ka ba o covered o ska I repeata ke re ge o mong I raise it number 1 sir.
Thank you very much for the opportunity. I go by the name of Gifted Jack
Ke kopa as a belief ge o bolela o re nna ke nna Rebecca Digamela, ke nna chairperson ya portfolio committee ya health ya Gauteng. Le wena o ipolele gore ko wena mang le company if una le yona or something, I don't know, mara bolela ka mokgono.
Ke a leboha haholo. Dumelang everybody that is in the room. Dumelang MEC and the team. I go by the name of Gifted Jack Mhlambi. I run a company called Gifted Jack. I'm the president and founder of an organization called Global Tenderpreneurs, whereby I train people how to tender. I've got a question for the AMC. I'm very glad that you and your team have a system that you are using. My only challenge about the system get introduced and then people get to be told after. Even in your department, you learn about the system after it's been introduced or after it has caused a problem. Why is it that why can't you introduce a system, train your people, come to the people on the ground, inform us about the system that is coming, then you can roll it out? That is my first question. My second question is about the inclusive of suppliers in these billions that were counted there. If we can be transparent, we would like to know as a community or suppliers, the demographics of how many blacks and how many whites have received tenders for those billions that were accounted for. Because as a supplier, I've registered my company with the CSD in 2014. Even I've hardly received quotations from the Department of Health. And even if I get, I think I've got about a few of them, I've never won even a single. So I'd like to know, is the department going to introduce any transparency when it comes to these billions being introduced there? Because I can guarantee you, most of the people that are there are white-owned companies. Thank you.
Thank you. Number 2, uko morago kwa, yeah.
Dumelang. Nna ke khuluma lona ke tswa ke le mo 25 polokong ka ra Sedibeng. Ke utlwile ka di budget tse baduweng, but I didn't get any financial report ho tswa ko Kopanong Hospital and Sebokeng Hospital. And again, like re tlile bo radi business. I would like go tsebe hore ka ra mo di clinicing le di hospital rona re batla re le bo radi business re tsebe hore re tendera jwang le rona hore at least government le lona e re assist hore lona re bo radi business le re khona go supplier ko di local clinics tsa rona le di hospital. Thank you.
Number 3.
Dumelang. Lebitso la ka ke Boitumelo Joko, ke tswa ko Ward 98 ko Tutuza. Ke na le question ho department. Ke a le dumedisa. Question ya pele ke nang le yona ke batla ho tseba di procurement tse le di batlang for who supplier, who department ya lona. Le hore le selecta di company ha jwang hobane from 2014-15 re ntse re zama ho kena ho supplier for department re le bomme. So re batla ho tseba hore ke efeng di procurement tsa lona tse hlokehang so that our supplier re qala ke no data be re tseba hore ke no dima eng. And engwe ntho ene re kopa hape re kopa le re fa le di trainings for whatever e le hlokang for department ya health hore re dwe re tseba hore if ke tlo supplier dijo di tlo batla eng le trainer hore ke tlameha ke be company ya ka e raneha jwang. Ke a leboha.
Number 4, 5.
Igama lami ndingunontsha wakwaNciza. ndibhalise phaa uba ndiphuma kwi-Ekurhuleni Women in Development because bengazi nokuthi ipurpose yalo meeting yintoni. Otherwise, my company is Ndogose company. Stage some, I'm an aspiring supplier. But I will comment on what was presented. For example, the issue that we are receiving a financial report of tertiary and I suppose also regional hospitals. And my question is, when are we going to get the ones for the district and also for the clinics? Because I think in majority we are affected at that level. Now, we've got a long challenge as regions that are deprived of tertiary hospital treatment, where you have alluded to the fact that we've got foreigners, whether they are illegal or legal. I think my point is not linked to the legality, but to the fact that there is a statement in English that says charity begins at home. So if you happen to be an unfortunate person who is in Ekurhuleni and you want a bed in the tertiary institutions, it's possible that you may not get that bed because a foreigner is in that bed. So I think this is an old problem. I remember my friend lost a premature baby in Natal Sprite Hospital, and the doctor there shook his head and said, if this child was in a tertiary institution, he wouldn't die. That was long before, but we even have the same picture even now in terms of non-allocation of beds to the deprived regions, because there should be a number that we know that as Ekurhuleni, we've got 20 beds in the tertiary institutions. And it's not a matter of being told that the beds are filled, because we've got a right to be in those beds. Now, the other point is the fourth industrial revolution problem that you have put. I think the issue of IT has been there for years, and I don't think we've got effective training programs to meet the very challenges that you are telling us, because we should be telling us also that because people cannot fill these forms because they are needed in an IT form, this is what we have done to train the people. When I say train, I don't mean these 2-hour trainings, training. I think next time you come, you must tell us what fourth industrial revolution readiness programs are there. Now, you're telling us that we have got 500,000 coming from other provinces. It's an open secret that South Africa is a unitary state, and I heard somebody introducing herself as a researcher, and I think the department should be having anticipated numbers that are not necessarily provincial because of the previous experiences. And then so that next time when we get this presentation, that is covered, because it's a known fact that we are in a country where people are moving from province to province. Now, my last question is, seeing that we're in the Gauteng province, which has got local governments, what is the role of local government in all these deficient skills that you have been outlining? Because we should be getting a report that because of these deficiencies, we've asked the economic development departments in the local government to help us in equipping the people. So I think we have got a more preventive problems than problems. And then lastly, the expense that is paid by government on healthcare, I think is a deliberate expense that is planned to have a high cost of delivering of healthcare, because our healthcare is linked with giving of medicines and with curing of disease, and there is less on promotion of health and prevention of diseases. I've never been in a meeting, for example, in my ward, that is saying we're going to be given as a community. I don't have to go to the clinic to get healthcare. I've got to get the healthcare where I stay. I've never been invited in a committee meeting that is saying, is health education today on prevention of teenage pregnancy? And what I'm saying, the expenditure that we are having is a deliberate expenditure because we've failed to promote health and prevent diseases. Thank you.
Thank you, Sis Noncha. Number 5. Akere, we done this side. Are you going number 5? Okay. Kwa Isaac, ya ku morago.
Ke a leboha haholo fela. Ka ho fuwa sebaka re tlo bua fela. Nna, I'm a Reverend Lekoro, ke tswa ko Vanderbijl, ko rural. Ke na le dipotso tse mmalwanyana fela mona. Ke nahana tse ding se di cover-uwe ke mme a qeta ho bua hona jwale. My few questions is that you can have a good system in place to teach people how to put invoice. But if you have that system, the people are not trained well, they know the system. I think that thing is not important for us as suppliers. My company is Leposa Power Engineering. I'm staying in a rural area where I see most of the clinics. I didn't hear that we mention anything about the rural people. Maybe the people, they forget about us because we came from the rural. Kukule mme a bua mona hore if tjhelete e se fedile accrual, tjhelete e se fedile mo di suppliers di sa kgona ho patala. I just want to find out hore na tjhelete ba tlo e thola kae ha e se fedile because mo clinicing re bangata jwalo ka nantsa bua re overcrowded di foreigners. So ka mantswe a mang ha tjhelete e se fedile di suppliers will never get any help. And ha ke batlo add on to when se di bua bana ntho re bona mo the budget is good, everything is good, but to implement it to us as community is very difficult. Ke nahana hore rona re tlamehile re thusuwe jwale sa Africans. Some of these things we are in a learning curve to put invoices. Ha re so tsebe hore na ho etsahalang. Ke nahana hore in our local places, the wards, people can come and train the suppliers kambo rona batho ba di company because we need these things. So ne ke kopa hore ha re tswa mo re thusuweng hobane we came from disadvantage. I thank you.
Ra leboha, number 6.
Number 6. Dumelang. Ke a leboha monyetla. Thank you very much. My name is Margaret Makubela from Dynamic Health.
Yeah, mara wena au number 6.
Kile ka phamisa.
O tla boya, don't worry, re felletse bane. So ra re ska senya line no sa emisa letsoho o lebetse mara o tla tla ka morago. I'll give you a chance.
Ngiyabonga mgcini sihlalo. Sanibonani nonke, all protocol observed. Chairperson, amanye ama issues are being covered, ne? So my name is Togo Mahambana. I am from Etsakane. Lapho kunesibhedlela khona okuthiwa iPhulusong. When you're speaking of influx, ne? Especially kuyibhedlela lezi ezinkulu abo Charlotte Maxeke and Helen Joseph, whereby abantu abasuka ekuruleni with oncology problems bazithola futhi lapha banenkinga. Thina Etsakane sinesibhedlela. as the department, I would request ukuthi nisikhulise lesa sibhedlela and ni share those responsibilities so that nathi sizoba nawo ama wards where oncology patients are being catered for. Secondly, ngizocela stakeholder relations officer ukuthi axhumane nathi as stakeholders zasekuruleni so that sizobonisana ama problems akhona, because there are a lot of problems, health related problems ekuhlaleni. So a solution to that, to the limited cash available for the month, ngiyacabanga ukuthi when you distribute ama services to ibhedlela lezi zethu abo Betha Gqowe and all of those, then a problem angeke izibe khona. I thank you.
Number 7.
Sanibonani. Ngiyabonga Chairman, ngibonge nendlu yonke. Igama nguJabulani Makafula from ubuhle bamadoda Men's Forum eTsakane. Ngibuya ku Ward 84. So nginama questions ayi-2. In 2018 siye sathola i-award ye-infrastructure development clinic ekumele iyakhiwe eWard 84. But since 2018 to 2019, azange sike sithole information ukuthi kuhambani kuya phambili kanjani. So besoloku ngizama ku portfolio committee la ngizama ama emails, omunye ngithatha ngapho ngiletha ngapho, omunye ngithatha ngapho ngiyisa le. So azange ibe nenhlanhla ukuthi ngithole ukuthi information ihamba kanjani ngeclinic. So question number 2, bengicela ukubuza ukuthi ngapha eKoruleni asinayo i-men's clinic. Besicela nisizamele nje ukuthi singathola i-health clinic. Thank you.
Thank you. Number 8.
Ngiyabonga. Sanibonani, uJabulani wakamkhonza lo. Ibuya eTsakane eWard 83 ku buhle bamadoda Men's Forum. Ebengithanda ukuphakamisa mina ukuthi in terms of kunjana i-business ngendlela ngizwe ngakhona nama procurement, ukuthi kunesikhathi establishwa ama cooperatives, kwaba nelokhunjana ekuruleni cooperative league whereby la besithola khona information, but kwahamba yonke into yashabalala. Uma ngabe kunezinto ezitholakalayo or information ayitholakala information ayifinyelele ebantwini ngendlela efanele, ukuze ukuthi mhlambe mangabe kunezindlela zokubhida or ukuthenda ukuthi nabo bafake ngendlela abafaka ngayo. Kodwa ezama cooperatives esikhathini esiningi sivalelwe ngaphandle. Sibuhle bamadoda sinabafowethu abuke ama drug addicts ethi nababuya rehab kufanele kube nendlela ukuthi mhlambe ba keep busy kanjani. Asinayo indlela ukuthi mhlambe singaba keep busy ngale ndlela ukuthi bangasabuyeli kulesa simo lesa bebakuso. So in terms of business besithi mhlambe lama cooperatives asungulwa ekuruleni bokuyindlela ukuthi mhlambe nabo sibarubhe in kulama cooperatives sibanikeza umsebenzi babe nento abayenzayo. Kodwa kwamanje bayabuya baphinde futhi ba relapse futhi ngoba ayikho into abayenzayo. So siyacela kakhulu ukuthi ingathi singalithola lelo sizo lelo nama lokhunjana ama trainings for ama cooperatives. Sibele sisazi ukuthi uma ngabe mhlambe sinabo labafowethu mamapha amathuba wemisebenzi sibanikeza wona. Ngiyabonga.
Thank you. Number 9.
Erile nna ke dumedise kaofela di officially tse tlileng le di service provider. Ke nna Daniel Sehloho from Palace and Associates. Taba ya pele ke tlo ho buang ka yona ena ya electronic invoicing system. Sometimes kgwedi ya fela di purchase order di soka di etsiwa. nako e nngwe kgwedi ya fela purchase order di soka di etsiwa ke institutions tsa rona ke yona ntho e nngwe e e delayang di-payment tsa rona. And sometimes rona re mo, for example, month to month. Now, when I did contract extension letters, say, you are providing to two institutions. Institution e a purchase order under the same Department of Health, but extension letter contract, which is disturbing. Le ha re ba bolella batho ba hore ba contact the contract management, they are stubborn how ba tlo ba contact. Now, taba e nngwe hape sentse ke le teng mo ka ntho tsa di GRV. Sometimes le ha invoice purchase order le teng, invoice ya ka ke load ka nako even before month end or ba be le nako ya ho etsa di GRV. But sometimes o thola re invoice dula haholo sebaka mo ba sa itse di GRV. The officials tse ding tse di le tsona mo di institutions o thola motho o ile study leaving or o ile just annual leave ha ba re bolelle. Yano invoice di dula sebaka mole di emetse hore di processiwe ke bona. E re ke phahamise hape hore this month ke bone hona le di changes improvement e entsweng ke department re leboha haholo. Ke bone ha hona le run e entsweng hona this week payment e khona ho kena hona this week. So ke leboha haholo ka lebaka leo. Taba e nngwe ke batlang ho e tseba hape ke di communication ra rona rena le mathata re le service provider re fihlella jwang ko ho CFO. Please, before meeting wa ka sheko fela ha re ka ba le those details re ka thaba haholo. Nna re based mo Joburg CBD ke khale re ile ra trainiwa mo electronic invoicing system ke bua ka bo 2016. So ha ke tsebe hore ba bang ba sokang ba trainiwa hotla jwang, because once you register they invite you. Mari ere ke re nna it's a very simple thing. Once on the CSD o le registered nna hona le ba bang ba di service provider ba ke kgonang ho ba thusa hore ba khone ba upload di invoices tsa bone mo electronic system. So anyone who is satana le problem mari le rona le bo di CSD number na le vendor number, I'm available free of charge hore ke khone re thuse batho ba ko ha rona. Ke a leboha.
Number 10.
Thank you so much, Chair. Dr. Rebecca. Ke Meshak Mtibedi from Val area. Ntwapele ko hore ke rata o leboha department. Particularly you as a portfolio chair le MEC, including the collective. Hona le improvement e ngata e etsahetseng indeed. From the previous engagement, ile nyabateng, in whereby one of the statement, salient sites were CFO hore certain billions were returning back to the provincial treasury. Today, the CFO is saying something completely different. There is a lot of improvement that need to be indeed to be congratulated. Thank you so much, CFO. Issue ya bobedi ke tlile le business people from Val area, young people in particular, and the elderly. As you might know, Val area at some point, there is a situation in whereby they've been neglected. Now, it is for that reason, I will request you, portfolio chair, kindly dedicate one official to these people from the Val area. They are aspiring. They want to do business with government. They are registered, but they don't have any contact on whatsoever. So, one official to guide them, to take them through. Number 2.
Hello, sir. Ke kopa o repeat sentence ya ko morago o boletse something o ka ra ba e capture sharp. O boletse ka tray go involve youth ya ko Val. Bolela hore o tlhoka hore thuso o suggesta e byang.
All right.
Yeah.
Thank you so much, sir. They comply in terms of the paperwork in relation to a business. However, there is a need for a dedicated official who will take them through how to do business with government, what requirements in terms of the paperwork and stuff like that. They are with me here. I will appreciate, even after this presentation, that official should meet with them. And so that from there they have a direct contact. There is an official and then I introduce the stakeholders. I think that official is critical to us. Engagement without necessarily communicating directly with yourself or with our MEC, whilst there is an official. We'll appreciate if that official are dealing with the stakeholder relations so that we could have a bilateral jointly with all of us. Lastly, portfolio chair, Rebecca, only a particular project. Our premier side to hurry. Government is going to more than 30 days in paying the service providers. Because once government does not pay these people, there is a potential or business abona ditloa. So I keep out 30, 60 and 90 days. Let's stick to the 30-day period. When I about to hospital, they are with us here. I want to ask that team who an official, particularly you, the CFO. Those people have not been paid, yet they've provided the service. Why? Why? I think that matter needs to be attended as an yesterday. Thank you so much.
Thank you. Number 11.
Good morning, everyone. The name is Nkosnati Bongani Mapena. I'm director of Miela Business Enterprises, based here in the East Rand. I've got two questions purely for the CFO. My first question, okay, let me just introduce first what we do. We are a supplier in the Gauteng Health. We work in the, as the CFO put it, conditional grant, or under the conditional grant budget, where we provide those health technologies and implants. So that you guys can be very direct with exactly what I'm talking about. So main reason why I came here specifically is because I know with what we do on the part of the business that we do for the government, we do take quite a bit of a huge chunk on the budgets that are given. Now, what I want to, for the first question or comment that I have is that I'd like you guys to actually dissect who exactly gets or who submits those invoices to you as government for payments. Because we've got a monopoly that's going on in there and we feel discriminated as the smaller guys. The discrimination comes through whereby because surgeons or doctors are the ones that choose who gets used, who gets to provide the service, we find ourselves in a space whereby we're competing with guys that have been in this industry for probably 20, 30 years. Or even 50 international guys. So when you come there as a small guy, it becomes very difficult for you to participate because again, purely it's professional preference because this product has done well before or whatever. But there isn't an allocation of sort that no, a hospital can only give maybe let's say Miela 2% of the budget and give this other guy because he's got more staff or a bigger guy 5% of the budget. There's no allocations like that. We basically at the mercy of surgeons, doctors. Unfortunately, some might not like to hear me say this and might discriminate against me in the future, but it's something that has to be said. I've had discussions with professors, I've had discussions with HODs of department. They'll tell me that no, they don't discriminate, but when you get to the floor to their juniors, unfortunately their juniors will promise, no, we'll use your product consistently, but still no response. But all at the same time, they keep on saying that, no, we're going to call you and use you, but they keep on using the same people over and over. So what I'd like first is that please dissect who are you paying. I think it's very important. That's a question maybe that everyone has on this floor. Who are you exactly paying? Do you even know how much you're paying them directly? You know, I'm not saying it from a disrespectful point. Please don't get me wrong. I'm just saying that do you really know who's actually benefiting out of this? Because there's a lot of small companies that are operating in your spaces, but they fail because they are older companies who have better history and are much more preferred than some of us smaller guys. So we'd like you to look at that, maybe create some kind of a partitioning within the next tenders that are going to come out with regards to what we do. And then the second question that I have is basically with regards to the EIS system. If I can be on the same page as you, I'd like to thank my brother there who said he'll offer his services to assist us. With regards to the EIS system, one of the biggest problems we face, again, where we work, you get to, because we work in the theater environment in the hospital. So you get there, you don't know if actually the person that's receiving your delivery note or whatever purchase order or whatever that you're going to give them even knows what that EIS system is. So we just want to find out as well, are you guys making the same effort on your side to equip the people that are actually the nurses, the floor nurses, the doctors themselves to know exactly? Now I'm not talking about the senior guys. The HOD might be aware and know what's happening, but when a new guy who's an intern who's coming in through a rotation doesn't know what a web board or an EIS system that you guys are using to submit invoices, because we do get those queries where, how much is this, how much is that? So it's like, but you guys should know this because there were tenders out for this. You know, so can we please, we also requesting as well that please equip the guys in the hospitals. It'll make them so much easier for them as well to accept us when we're coming there to do business, because they need to realize that, unfortunately, it's not their private practices. This is government business. It's not about preference as you as a surgeon, but it's about equity for everyone who's involved. So that's all I have to say. Thank you so much.
The first round is finished. Are there any other hands? I already have number one. Kinali already number one. Lena ke lena ba brainwave. So litlo bolela 2 minutes. A kere ne le teng mara la emisa matsogo. Number one ke my sister ko morago. Let's start from the back. A kere lena ne le teng la se emise matsogo. So number one ke my sister, number two, emisamba bohle a ke sa tlo boya ke last round. Number one, number two, number three, ke fitile. Mo a hona letsoho ne. Number 4, 5, 6, 7, 8, 9. Let's go repeat that. Tse di buletseng ke ba le ba fitile le tla ka new comments a kere. Number 1, 2 minutes. Oh, go staging. Or are thomeng afresh. Number 1, number 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 2 minutes, and I'm going to, 2 minutes, how we fedile. I can really not for faitile opportunity, I will come co prepare the presentation. Number 1.
Kialebong famnietla, Mara Nerin Pamisitse Matzor, Bella Chokamra Repamisits. Libitolaka ke Margaret Makwela from Dynamic Health Educational Training Institute. He represented the accredited providers for the upskillment of the community. We are accredited with HWCTA and QTCO. And talk about the procurement criteria for the skill training in the community. That will be helping the healthcare system in the shortages of nurses. Are they recognized? Because we're trying log in to try the skills funding to train the community, and especially our youth, the youngsters, the young adults, to be trained as nurses, based on Department of Health. Because all the accredited providers, we are trained so much. Even if then we train them, but hababatse go di clinicing, hababatse go di petleleng. And then we are saying, what's the use of us to give the skill to the community that is
lenya introducer ki government SWC because they're under the government, and yet abaqashwe habatsewi. They don't recognize their diplomas and their certificates. Ke batla ho tseba eo fela because now they are training but without employment. So ke batla ho tseba re tsena byang ko procurement ya lona le criteria go le rona le re tseye gore bana ba rona they must be trained. Ba thole di funds tsa ho trainwa ba bile hape ba baqashwe in their community. Ke a leboha.
Number 2. Thank you. Come, is here. Can we be, yes.
Dumelang. Lebitso la ka ke Masidiso Phate ke tswa Valley, in fact Sharpeville ne. Potso ya ka ke nana D2 fela tse ke tlo di botsang. Ke kopa ho botsa hore no ha ke botse ke a be. Government a kere e dumetse hore bana ba etse bana while studying ne. Potso ya ka ke na hore hona mo ke kopa ho kenya ya ka le nna hobane a kere government e re choose ditse baneng ba rona. Hore government e kenye e etse di mobile clinics dikolong ne, so that ngwana ha abana di complications ho bane le batho ba relevant to attend that matter ne. And hape yona ntwe eo hape ke kopa e go le note go le note mmene le imeditse matitjhere a imetswe, and enkutlwisang bohloko ke ya hore matitjhere ha kgethuwa hore le bomme le tla sebetsa mo le bontate le tla sebetsa mo, bana le bashemane bana le banana. Titjhere o thola go sekolong tsa bontate di 10 tsa bomme di 3 or 4, ngwana wa complicate sekolong ba etsang. Ke a kopa. Then ya boithu e ke kopang ke ya hore na government ya rona if e le ka nnete e re rata ebile e re nahanela ne, e dumelletse hore South Africa ho be mnate e be banana republic ne, mara ha e qetile ha e batle kapo ya iphapanya, I don't know, ho eketsa di kliniki, ho eketsa dikolo kore ba mela ha ena taba a ke tsebe ne. Ya o qetela ke tlo kopa whoever a ikarabellang ka pele ka mo, Johan Haynes, nna ke le Matshidiso Phate, ke kopa e bulwe e khutlisetswe maemong ane ene le hospital not clinic. Ke a kopa kore ke a kopa. Ke qetile.
Number 3. Can we have Wakile in the house to assist with the second mic?
Thank you, everybody. Ke a le dumedisa kaofela. Ka lebitso ke Tumelo Phatela from Katlehong. I'm with a company called Two Shall Become One. I have comments more than questions. I have only 2 comments. The first one being that we commemorate this effort to engage with stakeholders in Gauteng. Well, the second one is actually not a comment, it's a question. There has been a huge complication for black enterprise companies to trade with the government. They were using a certificate that we call a BEE certificate, and it gave black enterprises companies an advantage to compete with the guys who have been in the industry for about 50 years. But it being pulled back, it means that somebody with more experience and more work staff can now compete freely with price, meaning that his price can be very lower than the rest of the guys in here because he knows how to get it at a very cheaper price because he has been in the industry. As the Department of Health, how are you fighting back for the community to be able to fight back to and provide services with the government? Because out of the observation of everybody's challenge in here is that they have challenges to trade, meaning that they have lack of skill, meaning they can't employ those students that did accounting to help with invoices, delivery notes, and all the necessary documentation that people specializes in. your IT people and all that. It means that for us to dwell on training is still yet going to be another challenge, because if I am a teacher, I am a teacher. If he's an accountant, he has to be an accountant. And there's a reason why we specialize. So it means that there's lack of job allocations around Black enterprises. So the most important thing that is left with the Department of Health is to give Black enterprises jobs. Thank you.
Number 4, you know, ne re budgetile nako e itseng. There are other meetings which are also very important. And akere le nyaka hore MEC a respondele HOD. That is why ke le limit hore ya straight to question or comment. Bale ba pele be ke dumeletse because ne ke nana hore ke bona fela. Lena he letla, at least just go straight to the question and comment. Number 4, proceed.
Nyabonga mgcini sihlalo. Igama nginguSemfihlane. Ngibuya eValley. Ngirepresenta ama contractors ebesebenza eKopanong. Eyenza 300 bed ICU. Njengokuba sithole isimemo sokuba size lana, silethe isikhalo sethu. Kune portfolio committee, kukhona MEC, ne HOD nababo CFO. Njengokuba i-Department infrastructure ibi implementing agent. Sihlezi nayo phansi about 3 weeks ago. Lapho ibonise khona ukuthi portfolio committee health nama official ayo abekho ku meeting bebe memile ukuthi kuzo resolve inkinga esinayo yokungakhokhelwa. Lapho ngithe akukho khona lapho ngeke ngahlangana ne Department ye Health because ayakhi implementing agent DID. Manje isicelo sethu uthathwa zonke izinto ba shift ama goalpost balahlela inkinga yonke ku Department eye Health. Siyacela ukuthi as soon as possible nizame ukuthi nihlangane lapho nathi siyobizwa khona ukuba le issue yabantu abakoledwayo ikhone ukuba resolved, because sibekwa in a bad light lapho sisiwe nakuma state attorney as subcontractors, sayiswa nakuma senior councillors a private ukuthi thina singama contractors asevala ama SMME ebesebenza eKopanong si stope the new incoming contractor ekuyikhonko ekumele iphumelelise umsebenzi phambili. Siyathreatenwa si government, siyakhala manje simelana sithi niyasikhuthazelela njalo ukuba masibe ngama employers singabi ama employees, si create imisebenzi. Kodwa uma sizama ukwenza lokho kuba se alleviate unemployment ekhona, sitshelwa ngokuthi singabhadala. Sithreatenwe ngama lawyer, so siyacela intervention yenu bekhona.
Okay, lena ke lena ba bang ba litlileng la reporta bothata ba lena re a le tseba. So already Mr. Khobo o teng ka mo tla responda gore re ka thusana go ya pele bjang.
Re a leboga mama.
Number 5. Here. Le ka se eme pleke one musi. Wakile ko pele Isaac ko morago.
Ngiyabonga igama nguNtokozo. I am in the orthopedic space where we supply consignment stock into the hospitals. What I wanted to find out from especially finance department is that is there any money going forward to pay for the outstanding debt and the accruals thereof, especially in the tertiary institutions, the big 5 or big 6 hospitals? Thank you.
Thank you. Number 6.
Re ke le dumedise kaofela ka hare ho holo ha mmoho le MEC ko hlomphile. Bitso la ka ke Mapaseka Tshotetse from Val. Nkekebe ka phetha ntho e ntate a e buileng ka mona, but he ne re kopa ho tseba re le bo makgwebo le bo rakgwebo ba banyane be leng hore ba qala. Ha esale ke le hore ke le ka register a company ya ka from 2013. Company ya ka ke Gin and John. Up until now I've been trying hore ke kene ko department ya health, then ba tla bisa kwana le kwana. So pila ke eng ntho e leng hore ya nyakeya hore mohlomong ha re batla ho supply ka some of things re tshwantse re di latelle. Ke yona ne ke batla ho itseba eo. Ke a leboha.
Thank you. Number 7.
Dumelang Tafoleng, ke dumedise le ntlo e kopane. Igama lami mina nguzanele Makalela from Mod 25. Mina akusi question ucela, like since well sinawo amaphepha si start ama companies wethu. Sicela ukuthi nisiphe I way forward because of it seems like this thing ihamba ngabantu abaphezulu nje kuphela. So tina la on the ground it seems like we are forgotten. So sicela ukuthi nathi sicela si recognize. Maybe nisiphe I platform sisibonakalise ukuthi nathi na lamaphepha kade siwayenzelayo. Ngiyabonga.
Thank you. Number 8. Siyabonga. Where is Isaac?
Hello, good day. Good day, everybody that's here present. My name is Peter Wagner. I'm a director of a company called Buns Holdings. I'm staying in Westbury, close to 2 hospitals, Ellen Joseph and Rahima Musa. Since 2014, I went into procurement, speak to them, ask them for RFQs, and they gave me RFQs from 2014. Every day it's quotation on quotation, quotation on quotation. I even underquote myself. I'm not still getting any opportunity from those 2 hospitals. So which means it tells me there's a problem with procurement. I first was under the impression that I've got a problem, maybe I'm not complying with all the documents, only to come and find out all my documents are in order, but I'm not getting any opportunity from these 2 hospitals. And we had a meeting with the Premier of Gauteng 3 to 4 weeks ago, and there was a that was introduced to say township development, only to come and find out up till today, which means I've got a hell of a problem with procurement, supply chain. Thank you.
Thank you. Number 9. Can I see number 10 so that they already can be next to that person? Wakile, I think it will be upstairs. You must go there. Let's take her. You will follow, my sister. You will follow.
Khotsong Batlumu, ke le Teboho Tsiane from Maleka Holdings, P2I Ltd, and also a former member ya board ya old age home. Ne ke kopa at least some kind of raise the challenge ka bongata. And which then the challenges, I believe, will also somewhat tlamehile accompany the solutions. Then in terms of the supply service, now I believe all right in that the procurement ya rona tlamehile I review. Then it's channeled to a certain area. then which it does not cover us, especially for the townships. Then I'm saying that based on then most the invoices, they are much forecast for the provincial and also the national departments. Then if you check there, then you are saying who the service providers both to go the hospital as long as who render a service ko departmenting, which number one, I believe the old age homes kaufela tsona, even though I believe they are classified under a primary level, which it can be grouped the primary health services. But at some point, objective ya rona re batla ho ensure hore health system ya rona e be better. Then that's an overall objective, irrespective of hore le channel te go kae. And if you check, you have rendered the consultation, but focused only ko ba loring ba haufi le lona. Then mo ko marketing a re thole thuso e jwalo. Then ho bana le di satellite offices tse loring di tla ruta hore re procure and re invoice ka di sela tse right. Then I believe leona it can be something e loring tlamele, and nako e re sevileng as a government ngata haholo hore re busy re etsa di talk shows tsa ntho tse tshwanang ditse. And then for Sloras old age home currently each in a challenge ya the finances. I believe based on the allocation una le ntho e ba e bitsang di dry season, always it will late, and you can go to region, the regional office it will refer you to a provincial, which then ho bana le challenge, and by then hona le batho ba lo reng ba safara ba sebetsa ho bana e create di debts ka tsela tse ngata. Ke a leboha, apology on ka nako.
Thank you. Number 10. Go and my dear sis. Wakil.
Akelebohe batswadi.
Go up there.
Ke nna moleleki. Ke tswa ko Sidibeng. Ke tswa ko Sidibeng Emfuleni. Re mo di rurals tsa Emfuleni. Aholo re sebetsa ka dijalo. Business ya rona mona ke MB Crops and Poultry Commodities. Jwale re shota ka dijo tsa bophelo tse tshwantseng di ye hospitala. Hospitala di hloka dijo tsena tse re sebetsang ka tsona. Empa ntho enngwe e re shotang ka yona kila ka bula ntwena business ya mahi a di khotsa mahi. So now ha ke tshwantse ke fumane the security certificate hore ke tlo kgona ho deliver le mo di hospital ho fumantsha hore no ke a sugudiswa ke batho bane ba busa kana go tseo ba batla security ena e tshwantse ba batla ka tsela ya bona. But now pampiri ya ka ne sa bui jwalo until business ya ka e bewa, because we are next grade market. Jwale ke tshentshela ka mo di khohong di broilers le mo di vegetables. So now our plan ke hore now re be in commodities, because the plot tsa rona di ngata mole. Di ka fana dijo, di hospital, di clinicing, di kolong. We can do the lot ka di plot tsa rona tseno. Ha fela organizing committee ena ya hetse ha ka re thusa right. Masipala a khone hore recognizer a re kenye mo dateng and then a re bulele hore kre di commodities tsa rona di be tsela tse re tla producing ka teng di vegetables. E ka thusa haholo, and then e thusa haholo le batjha, because tshwantse be di cooperative batjha ba kopane mona plotong ena ba kopane mane jwalo. Then re tlo bana le dijo mo Gauteng. Ke a leboha.
Thank you. Number 10, 11.
Molweni luphambi kwenu nguNkululeko wakwalinganiso ethokoza kwindawo ekuthiwa kusePolar Park kiward 103 ndinemibuzo nje emithathu ayikho mide mifushane owokuqala uthi ingaba xa ngaba ufuna umsebenzi ku government une company yakho enegama layo ingaba ukuze nikwazi ukusithatha kumele ube nomuntu omhlophe ukuze uthathwe okanye mhlawumbe kumele ukwazi ukuzimela wena wedwa. Question number 2. Umbuzo wesibini uthi ingaba kungumthetho wase South Africa na ukuba kusuke umuntu wangaphaya eThembisa okanye Soweto okanye eTshwana eze azothola umsebenzi kwindawo yaseThokoza athi uma efika eze nabantu bakhe ekubeni bekhona abantu balendawo ekuthiwa kuseThokoza. Okay? Question number 3. Ekuqaleni phaya bekuye kuthiwe kunemali ebuyela emuva ayisebenzanga kumasipala othile kuthiwe ibuyele emuva ingaba leyo mali leyo ihambe iphelele kuphi? Ndigqibile ndiyabulela enkosi.
Siyabonga. Number 13. Please go up. I told you to spread the two of you. One should be this side. You can't be following each other like that.
Sanbonani, leaders on front, bengithanda ukubulisa nomphakathi. Igama umncedisi Terence Buthelezi. I'm from Fosloras. My company name is 100 TM Buthelezi and Projects. NPO Igwaze. Then I'm also a ward committee under Infrastructure Services. Program Director, thanks for the presentation. Firstly, is to welcome the opportunity. But as communities who are disadvantaged of the opportunities that happen within the departments, our hospitals, clinics, and so forth. So what I would besicela ukuthi that office monitoring and evaluation isicela ukuthi isebenze within this department so that there is a transparency on businesses, opportunities as service providers and also kuma procurement. Because uthola ukuthi abantu abatholi imisebenzi. One, you'll name the hospital esikuyo la eFosloras, Itelem Khwerane Hospital. Opportunities are not afforded to abantu abahlalayo. And isibhedlela sa introduce la a civic center to the community. But when we want to tap into the system, people have been applying for opportunities there at hospital, but it's difficult to break that system, to seventh. There's preferences, abantu asas baqashwa ngendlela ezinjani. So besicela ukuthi nisincede so that we can get opportunities ezilapha. But another issue that we have addressed CFO. You spoke about the workshop le eninikeze like ubaba lo beka presenter wages maroon. Besicela ukuthi also on Katoras and Fosloras nathi besicela that session so that nathi sikhona ukuthi si trainiwe as business people so that we can also be on your database as a department. Isikhona ukuthi nathi sithola ama opportunity ogenza ama RFQs as service providers, also maintenance and other services nazo within the departments. But also isicelo sami bengicela ukuthi nama opportunity la wemisebenzi now within the departments, your social auxiliary workers, nurses, causes, all of those, please afford them. Nibonisa abantu ukuthi system isebenza kanjani. How do you apply for work opportunities? Because as business people, sesinabantu aba-register ama-company because of the level of unemployment. Uthola ukuthi sesenkingeni, and kuma departments uthola ukuthi kunama preferences wabantu abahlala bathola ama RFQ abashintshwa at all times. Thank you.
Number 14.
Ngiyabonga, igama lami uNthapseng Jigega from Ward 46 under Women and Children, but now ngi-representa i-Fosterers Old Age Home, ngi-Secretary of Board of the Trustees. I-concern yam is, i-old age home is attempted to be closed because asiko registered nge-Department of Health. So my question is, if umuntu ongene ku-old age home ungene under organization waba i-proxy, why the elders kumele basafare because of i-proxy? Where is Department of Health visibility yakhona? They touch based on monitoring and evaluation. We have a problem with monitoring. Secondly, DSD is also saying because the structure does not comply, they are not going to fund. 3 months, home-based, nama caregivers are not paid because the structure is not complying. So if a Department of Health is there then to assist, why ama caregiver nama home-based bangabi absorbed by a Department of Health? Because at the end of the day, abomkhulu nabogogo abasafarai. I think monitoring and evaluation is forever not present. Because we raise our concerns and our compliments, but no one is doing a follow-up on saying, we did receive your complaint on this and that, so how can we assist, or were you assisted or whatsoever? No one is doing a follow-up. So, ngaleso skhathi mawuthi uya-check, every time kune negligence yezinto, but because we feel ukuthi somebody then is paid ukuthi izinto zenzeke ngendlela wrong, that is why kungena monitoring and evaluation. And khona i-group, inozipho support group, last year assisted ngo-October ukuthi bacele abomama, they must go to i-pap smear. I-Department of Health ngaleso sikhathi leso izithulele abantu okoqala bafuna ukwenza ama-pap smears because i-service ey'bhedlela nasemaklinik it's very poor. Kodwa abantu, when they are pushed to go do that, no one is recognizing abantu abangaholi, abantu abaholayo baya etiyeni ekuseni ngo-8 mabafika baya elunchini.
Sorry, I think you've got other important points. I'm going to ask you to come and then you give me all those, because for now we want to give the department opportunity to respond. Modi issues in the supplier before batsamaya banale another meeting. Mara what you are raising ngwanako hai key rena as committee re a tlhoka information ya gago. So be ke kopela hore utle mo ho nna re di kwale di officials tse dingwe di tlo remain behind.
Okay. Bengithi wena uzothi ama officials ngoba yaphuma ngicela kube khona umuntu okathendayo because nami ngiziraise because kumele ngibuyele emsebenzini.
No, there are two. Khona le two people ba kenyakang hore before batsamaya ba responded to all the other issues. MEC le CFO.
MEC ke mkupa here before batsamaya.
HOD is here. He's not going to leave. Ne? Akira ke mokhathi.
Sanibonani. Sihlalo. MEC Ngiyabingelela and all protocol observed. Lo okhulumayo uThembi wakwaMasondo eWard 85 oheda ku Ward Committee ku Health and Social Development. Department sicela ukuthi ni consider ikwatsa duza. I-training siyayicela nathi. As kunama service providers njalo ayaziphinda-phinda ema-clinics ey'bhedlela. So sicela ukuthi ngeni beke ilihlo lapho. That's number 1. Number 2, i-Helixdal Clinic. Leya clinic incane kakhulu. Sicela ukuthi ngathi ningazama nis-extendele and i-service yakhona iphuwa ufika lapha ngo-7 uyophuma ngo-4. Ngoba bayaphuma bayangena uyetiyeni uyahamba uyabuya. Sicela ukuthi nakhona nike nibheke ni-extendele leya clinic. And abantwana abaningi abasebenzi. So abakhathele ukusebenza nibakhiphe nidede nivulela abantwana. Ngoba abakhathele badonsa inyawo bafuna ukusebenza. Sicela ukuthi nibeke ilihlo.
My dear sis, akiri other problems di botlhokwa mara MEC le CFO ba tshwanetse ba responde go di issues tsa di suppliers, which are the main topic e re tlileng ka yona. Mara a re gane di complain tse dingwe rena as a committee re accepta all the problems. So ne ke kopa gore le wena o tle mo o tlo mphe, because the officials ba tshwanetseng ba responde go all other issues.
Siyabonga.
Iseng mara for now ne ke kopa tswetswe gore can I allow ba responde so that ba kgone go ya go attend another meeting. Wena come here pay other problems. I will make sure gore ba respond to all the other issues before ba tsamaya.
Siyabonga kodwa uyasuppressa program director.
Mara kere meeting re tlile ka di suppliers. Ke tlo fa mara rena re le fa opportunity bile a re le team. Ibile a se la ntlha re tla re tlo phela re tla. Last week ne re le at Ridgeville. Hello. And then na re a leboga gore le raise the issues ka mo meeting. So akere mara re tshwanetse re be le go considera gore go na le meeting e meng. So nakong nna he ke le mo go tlhokega training ya di SMME ka system ela ya di invoice. I can even tell you re biditse department last year gore why 18 billion ya Department of Health ya supplier ya medication le medical equipment e benefita capitalism more than lena. So rena we are here to make sure nyaka o bona go benefita lena. So rena le lena ba respondile go benefita big companies more than lena. Ke dilo tse re nyakang gore lena le create that opportunity mara training e key mo go lena. Question ya mafelo MEC e tlile ka SMS from a supplier. E re ke e bale and then the questions tse dingwe di tlo respondiwa. Are my challenge is Marlboro Medical Supply is producing bandages and linen savers, but the department does not recognize the local manufacturer. They choose to support import suppliers for those who do not create job opportunities here in the province. So we are not allowed to see the HOD or MEC even when we send emails as they request and there are no responses. So they should give every SME a chance to supply, not friends companies. The government work must be open to everyone. Akere ntlha e re tlileng ka yona ke di suppliers more than other issues. Are di hane as committee re take everything, but for now ke tlo kopela MEC a responde. There is a need for training at the SMME because the training was done maybe long time ago. You need to know how to access the system so that the invoice is selling. It's a my sharp. So MEC, it's your time to respond, especially on those issues that the SMME and the CFO. You must please respond. The issues are raised and they are very important. The beneficiaries of government, ke other people more than our own people here. Thank you.
Itingbonge bantu abadala as a department I think sinizwile ukuthi nithini, and as the CFO has already explained ukuthi we are going to have a meeting with all the suppliers so that we can, one, educate them how to capture their invoices on the system to make sure that we pay within 30 days. Number two, I think all of us were listening to uPremier Magayenza State of the Province address. We were committing ngokuthi because the Department of Health, DID, and social development is not paying their suppliers within 30 days, uzoyenza war room. That war room has been established and the committee is reporting to us as EXCO. So we will be making sure that all your issues that you raised and your comments, we are taking them very serious so that we can be able to address the issues. There's one of ubaba ote umuntu asuke etembisa azopana ngeservice la. So we're going to make sure that we address all those issues. But as I was listening, there are issues of service delivery, there are issues of supply chain that the CFO will respond to. There are issues of infrastructure that Mr. Kobo will respond to. I think I saw Dr. Ngwabe she's sitting somewhere. Angas azos respondela ge issues ezibezureza umama zama long queues namanesi aya ATN for a very long time. Thank you very much, Chair. Through you, I'm going to hand over to the CFO. And then Dr. Khongwana and Mr. Kobo, and lastly, Dr. Ngwabi. Thank you.
Thank you, MEC. Chairperson, through you, I'm going to try and apologies. I'm going to try and respond to the question. Some of them, I'll try to speak English, and some I'll try to speak Sesotho or Setswana. There was a speaker number one in the first group who raised a question or a comment, as and when we update systems, we don't consult with the public. We introduce systems, and only then do we bring systems to you which you are not knowledgeable of, or you did not even know how to make use of them. We take note of that, and the most important thing I realize it's in health, it's that, okay, there are systems that are developed in the province. We are informed of. Like for instance, the system here, EIS, it's a provincial system that Gauteng has developed. But we come to realize that as Gauteng, there are also systems that Gauteng Department of Health, there are systems that which will suit us as Gauteng only. Like for instance, we don't have a platform that focuses on inquiries and monitor how much progress we are making on those inquiries. So it's an ICT model that we are now going to develop in the new financial year. Of course, before implementation, we'll come and introduce it to you so that you can then look into it and how then you can make your contributions. This system will not only look into inquiries that are brought into Department of Health, but at least monitor how long does it take for us as Department of Health to attend to the query and also keep you posted. Like for instance, the system that SARS has got, you know, when you submit your SARS tax claim of your company, they will inform you that your tax compliance or tax issues have now been received or are receiving attention. So you will then get a response that will say your tax certificate has been submitted, please go and collect ko kai kai. So we also want to introduce a system like that that will indicate the number of the inquiries that you are making, when did they arrive, how long does it take for us, or who is attending to that issue, and how long is it going to take for the department to then respond. On the second issue of inclusion of suppliers within the demographics and how black people and white people receive businesses in Gauteng. For obvious reasons, we keep track of business opportunities given to different designated groups. But in the true sense of the matter, South Africa is an equal country, and everyone has got an equal right or equal opportunity to do business with the state and to also do business with the private sector. So we don't necessarily discriminate to say business is given to blacks only, or business is given to coloreds, or business is given to blacks. We give everyone an opportunity to then tender and get a business opportunity. Previously, we had systems in place that would provide, or was biased to provide, business opportunity to historically disadvantaged individuals. Whether you are black, you are colored, or Indian, you were then given preference, unlike white people in the country. But ever since the court ruling that has happened now of late, we are told that that act or that regulation is unlawful. Everyone needs to be given an equal opportunity, whether you are white or you are black, and therefore that regulation has now been done away with. And then speaker number 2 was talking to issues of Kopanong and Sebokeng expenditure. In the next reporting, we will then be able to give you that information to say, how did the hospitals perform in terms of business opportunities from a supply chain perspective. We will also give training. I think majority of our people wanted us to comment on what is it that we are going to do to give you training opportunities on how to do business with government, not only do business with Gauteng Health, because we apply the same system. So the issue of knowing how to tender and what is required when you do your tender is also one of the key issues that we're looking into. And as and when we do our workshops, we will then inform you of the mistakes that companies do for them to be disqualified in terms of tender administration. But also, when you submit your quotation, when you are told to submit the quotation within 24 hours or within 7 days, and cut-off time is 12 o'clock midday, for an example, please make sure that you also submit. So these are the things that we are going to discuss as and when we look into these training sessions at the workshops. Speaker number 3 spoke about what is required and how are companies now selected. The one thing that is there is the selection of company is through CSD. So when we enter into a system, we then make a selection, and I must be honest, our people would register to supply everything. When you go into CSD, there's a selection on the type of business you want to provide. You'll find an SMME saying, I can provide health equipment, I can provide food, I can provide needles, I can provide bandages, I can provide cleaning material. But when that company is selected to say, give us a quotation on cleaning material that you can supply, they don't respond, or they will then say, I don't have capacity, or I don't know where to source the material from. So it is a serious challenge when we have to select companies who are not able to provide the business that we need. And as and when you quote, you don't have a way of knowing what the cost price is from the main manufacturer. Where now when you submit your quotation, you don't look in, or you look into what the main manufacturer is charging. You will add your price 3 times or 4 times more than what the average cost of the other person is. So in that way, you are then not given a business opportunity because your price is 10 times more than what the general manufacturer would charge. So these are things that we will discuss at the workshop, and so that we can then, educate our people on how to do your quotation and what is then required. Remember, the HDI and SBD forms that will say, are you black or are you white, are you colored, is no longer there. So what is going to matter from now on is your price. So when your price is higher than the other one, and even if you've underquoted and the market price is saying this toilet roll on average would be 5 rand. When you quote it at 3 rand, you will not be selected because we know you will not be able to supply because you are going to work on a loss as a business owner. So when you quote, it's not only about underquoting or overquoting, but price your quotation in such a way that we would be able to consider you for a business opportunity. Like I said, the selection process is through the system. CSD will then have a register of suppliers that we select. We don't necessarily have our own suppliers that we select, but it's on the basis of the CSD system. And then SP5 and 6, we're talking to issues of training. The issues of extension of Pulusong Hospital, I think Mr. Kobo, as head of infrastructure, will respond to that one. Cooperatives established, information does not filter through to people. Okay, on the issue of cooperatives getting businesses in government, for obvious reasons, Bahaitso, we've got NPOs that are coming in as NPOs, and then we've got businesses that are, or companies that are coming in as individual businesses. So we cannot necessarily select business opportunities and say these ones are specifically for NPOs, these ones are specifically for individual. In the world of business, obviously you have to compete and you need to come up with something that is unique that others don't have. So when you volunteer or when you come up with a business opportunity, please do not select a business opportunity that everybody has got. When we've got 1,000 suppliers who can provide bread, for an example, then we'll have to give businesses to every bread supplier. So the one thing that we want to teach our people is to say, come up with a niche or something that is unique that government doesn't have. So that when we give you a business opportunity, you would be an advantaged competitor. But in general, we know majority of our SMMEs are not necessarily informed on business opportunities. So the Department of Economic Development has also a platform where they capacitate small and medium enterprises on business opportunities that government does and how then you can then get access to those type of businesses. The issue of Speaker number 9 and number 10 was talking to provisioning of youth opportunities given to opportunities given to young people. And then also our process of communication and how do you raise complaints. So as I was saying, there's a structure in place currently that deals with inquiries. But we now want to have this system upgraded or developed in such a way that every inquiry is attended to and we can then respond to you as and when you make an inquiry. Speaker number 11, rotation of the system. Like I said, CSD rotates suppliers. So we then select companies from the system and request them to give opportunities. Obviously, like I said, our people have got a challenge of underquoting or even not responding to the request. And this therefore deprives them of opportunities. But it's something that we are going to look into again as to how often do other companies get businesses in the organization. And if there's any acts of corruption or maybe maladministration, we will attend to those issues. In the second group, Chairperson, the speaker number 1 was talking to HWCTA, and I think Dr. Hongwana will respond to that issue. Mobile clinics, speaker number 2 at schools, the department will look into that issue. And the issue of Johan Haynes, the department will also look into that issue. I must say, Bahaitso, it's not easy for government to just decide whether a ward or a district qualifies for a clinic. We depend on institutions like Stats SA that will then determine the demographic or the biographic information of a particular district. So for us to say this region qualifies to have a tertiary hospital, it's on the basis of the population and the growth of that population within that area. So it's not only about us now converting a facility and saying you no longer are a clinic, you are then a tertiary hospital. And in that case, once a facility is then reclassified into a higher service of healthcare, it will then also have financial implications. So we will have more nursing staff required, more specialists being brought on board, and that also requires money. So reclassification of a facility is not only to say, yes, it's no longer a district hospital, it's now becoming a tertiary hospital. We will require specialists to come on board, increased number of nursing to come on board. It means now cost relating to servicing that hospital is now increasing. So it does not necessarily take a once-off decision for an organization to come forth, but it requires us as government to consider all other different aspects that would contribute to a reclassification of a facility. The issue of rollovers, I think I spoke at length in our previous meeting in Tshwane, Chairperson, on how then the money that was not spent on conditional grant is transferred to or rolled over, or let me say transferred to National Treasury. That money has been requested to be rolled over into the new financial year. And luckily, we've even gotten permission from the Provincial Treasury to say all expenses that were incurred relating to funding that was not spent in the new financial year can then be spent in the first quarter of the new financial year. So the invoices that we had received that could not be paid with monies rolled over into the new year has now been paid in the first month of April and May as per a report that I had issued. On speaker number 6, what is required to provide businesses at health? Look, in government, obviously, I would not necessarily want to speak to health only, but I'm referring to all other government institutions. Remember, when you provide business, you need to be registered as a business or a service provider within government. And this now requires you to be tax registered. You must have a valid address. You must have a valid ID. You must be, almost like a citizen of the country for you to get business opportunities. We are not saying we are not giving opportunities to external, incumbents or inhabitants in South Africa, but preference is given to companies that are registered and that are for citizens of the country. So there is a system within the Treasury website that gives an indication as to what then is required when you need to register as a business owner and to do a business with government. So majority of the questions that were asked were talking to business opportunities. And honestly speaking, we want to give preference to young people to receive businesses in health. But majority of our business owners who are young do not necessarily have funding and do not necessarily have what it takes in terms of providing us with the resources that we need. So health department is not necessarily an organization that is established to capacitate black-owned companies or companies which are youth-owned for them to get business opportunities. Our role is to provide healthcare services. Departments such as economic development would then be placed or best placed to then provide with such knowledge. So I would encourage our people to really keep in touch with economic development and also with the Provincial Treasury so that they can inform you of what is now required for you to receive business opportunities in government. Speaker number 10 spoke of a land that they have and would want to provide food and agricultural resources to government. We take note of that, and I would suggest, Papa, that you maybe communicate with Department of Agriculture, because we are now talking to agriculture in terms of providing small and medium enterprises, especially women-owned firms, which will now be given opportunities to plant or to grow vegetables and fruits so that those can then be contracted into health. We want to give women, youth-owned companies opportunities, but that is now an initiative or a plan. Department of Agriculture. So if you can keep in touch with agriculture, they will then be able to assist in terms of keeping you in their database and maybe look into opportunities of providing you with seeds and other tools, maybe water, equipments that you will need in your farm. And then speaker number 11 was talking to the issue of okay, speaker number 5, I think, I'm not sure if I responded to your question when you spoke of debt and how then do we settle accruals. The biggest challenge that we have, like I said, is the overcommitment. So every year we've got companies that we owe millions and millions of rents that we could not pay in the previous financial year, but then are obligated to pay in the new financial year. So, like for an example, I'll give an example of our goods and services budget. We had 18 billion last year. Our accruals were 4 billion, which means we spent the entire 18 billion, but we're still left with 4 billion that we could not pay. So in the new financial year, with the budget now having increased to about 19 billion, we first start with settling the 4 billion of the previous year. Now it becomes a challenge because every year we are rolling over commitments and invoices that we can't settle almost during the fourth quarter of the financial year. The solution that we are proposing is to then control procurement throughout the year so that we reduce balances of, we can never say we will finish off accruals in one financial year, but every year, at least let's try and minimize the amount. We started with 4 billion. If we can get to 3 billion, get to 2 billion, 1 billion, then at least, we would move. But I said something quite critical when I was presenting, that Gauteng has an influx of people looking for job opportunities, looking for business, looking for health in the province compared to all other. So the demand is a lot, but the supply is very little. Our budget this year was only increased with 1% if we do a proper analysis. I mean, moving from 59.2 to 59.4, it's very little. And in the true sense of the matter, we can never accommodate the needs that the public has in terms of provisioning of healthcare services. I think the issue of business opportunities I responded to. Chairperson, if you can allow me to park here and allow other colleagues to respond, I would appreciate it. Thank you. Sanitizer.
Okay, Erki. Okay, all right. Mr. Corbin, Bakhaitsu, ke a leboga. E re ke arabe dipotso tse di rileng. Mo ke tshwere pampiri tswang ko Tambo Memorial Hospital. Ke Boxback, Ego Boxback. And the CEO mphile pampiri a re there's about 27 companies tse di run business le Tambo Memorial. So just and tsotlhe di tswa gona mo Ekurhuleni, bo Springs, bo Katlehong, bo Rabi Reach, bo Benoni. So just for your information. So okay, advice when you need information, don't feel afraid. Don't give up on talking to the local districts and the local community hospitals or CHCs. But that's very important because they will give you information. Also in terms of following up on issues of GRVs and payments, I think create that relationship with the hospitals. I will ask the hospitals to have at least a quarterly report for small businesses that deal with, or suppliers or service providers with hospitals and districts. I am committing to that. I'm going to write to my colleagues, please have quarterly reports so that there's confidence built for our communities. Now, Magogo ubile ka patients from other provinces. Just for your information, Gauteng serves Mpumalanga, Northwest, and Limpopo for tertiary services. So the services that I hear in Gauteng for tertiary services are not only for Gauteng people, but they're for other provinces. So let's just understand that. Information. We've got 4 central hospitals, Krisani Bara, Charlotte Manklaike, Dr. Josh Mukari, and Steve Biko Academic. And we've got 3 tertiary hospitals, Tembisa, it's Calafong, and Helen Josephs. So, and those services are expensive, like oncology for cancer treatment are very expensive. That's why we have only 2 hospitals in Gauteng at the moment, Zedina radiation therapy, which is Charlotte and Steve Biko Academic Hospital. We are planning to have Dr. Josh Mukari and Bara also have the same services. We're busy with the process. There's already POs for those companies to build the bunkers and to give the linear accelerators. So we're taking the issues of oncology very seriously. We're having every 2 weeks meetings with the Cancer Alliance and the specialists in the province to how do we improve the management of cancer. So I wanted to share that with you. The other issue is I think the issue of discussing with professors and doctors, I think let that continue because it helps to improve. In terms of training of nurses, there's issues of compliance. You must be registered, whether as an MPO or NGO, you must be registered. Remember as health, where the problem of the life is the tragedy. And that ghost is still hanging over us. And we need to redeem ourselves from that ghost, where we have NGOs that were not registered and compliant. So issues of compliance is non-negotiable. So you have to have a license, and it's the law of the country. You have to have a license and be accredited. So let's go stop go ba le dipelo tse ntle go direla setšhaba, but are comply. It's like our driver, or something level license or drive. For my metro police about stopper, you must show your license. There must be a license disc on your windscreen. So issues of compliance is very, very important for us and for you, and of course for Batubaborona. Please, please, please comply. And then the issue of mobile clinics, we have a school health programs, but we will take that message to the health school programs to say there's a suggestions from Batubaborona, consider mobile clinics, additional mobile clinics, the mobile clinics, but not many. We will talk to them about this proposal to have mobile clinics that will visit the Kolo and to assist. And also to strengthen community healthcare workers and your ward-based outreach teams. Joanne Haynes, with her she's a CFO, we'll take it to the relevant structures. Joanne Haynes will back to being a hospital. Retsa Sira said that kopo eo mama re amogetse re tla e gore re kgone go bereka mo go yona. I think CFO o tlhalositse gore go tlo ba le di processes, procedures, but re lebogela gore please Joanne Haynes, back to Joanne Haynes Hospital, not CHC. We will work on that one. The other thing, the nursing training, you have to have accreditation also. Remember, I left the Gauteng Nursing College, and we also have got private colleges that are different service providers. If you need licenses, you need to comply and apply for licenses to the department. The Office of the Chief of Operations, Kiona Idilani licenses, and even quality assurance. So we will be able to give you the email addresses to go and make your inquiries for how do you get licenses for training nurses. Like one or kids, sorry, everything. Yeah, the pap smears. Kitlokupa me willing the pap smears to contact after this for kids the details. There's a program mother and child health, so that we can give them that information about communicate, including more Ekorulane, the district manager Ekorulane would need to know there is but baba need including the old age homes, you need to comply. You need to comply. Licensing who deal the old age homes. We will continue bahacho ho tswela pele go dirisana le lona kopa le skare ngala e tlang go gona le re boleleng gore bona mo a le di bone. We are because you are batho ka lona ka ntle le rona a re stepe. So le skare ngala ra ka kopa le nna or please and re kopa le dithapelo gape le re rapedise gore le khone go le serva hantle. I get Chelly, la Waka ya Borreba ko Sidibeng ya Kopanong, what for Etla Salam Rahu, got the right channels who deal with that infrastructure ya Kopanong. I hope it touches everything Mahaitsu Galebo. That the cover.
And Tate Kobo utlo responda for the issues that DID, ne? Especially for business people from the Val.
Locha, thank you for the opportunity to give feedback on this forum. The notes I've made, most of it has been covered elsewhere. The number of tertiary beds has been taken care of, and we will then just wait for clinical to give us a request for service in that. That also covers Pulusong, the health clinics, mobile clinics the same way. In terms of Johan Haynes, maybe I should mention that what is in our books is to return Johan Haynes not just to a normal hospital, but to a mother and child. But again, that from infrastructure point of view, it's a question of what will be the final request coming to infrastructure. How do we convert? Is it to a normal hospital or is it to a mother and child hospital? That I must say, confirm that it is in our books. And if there's a change in terms of what's required from the clinical colleagues, we will do the same. In terms of Kopanong ABT, we've had a meeting with DID a couple of weeks ago. The challenge again is we as health have got DID as the implementing agent. They then hire a contractor to be in charge of the whole project. The contractor then goes and hires a subcontractor. So I'm like the fourth person away from where the actual work is happening. As much as we feel and agree that we shouldn't have a situation like this where the contractor who did the job is not being taken care of properly, our hands from health are tied in terms of the legal processes, in terms of the supply chain. But as I was saying, we didn't say like it's got nothing to do with us, because it is our building at the end of the day. Although before that happens, we need to have a complete building handed over to us once the building is completed by a DID. And out of that meeting, we then called in legal to say, what can we do? So we will then wait for DID to come with ideas to say, what do we do in this situation? But as it is, it's not an infrastructure issue per se. It's a supply chain, it's a legal issue, which we will then, as health, comply with whatever we are being advised as far as that's concerned. That is what I picked up as I was sitting out there listening to what the community have to say. Thank you.
Thank you very much. Ke nahana hore the questions that were raised, they were responded to. Rena, we created a platform hore le kgone ho bolela di issues. Tse dingwe is disappointing hore supplier a ya patediwa because officially le leaving. Ewe is unacceptable, CFO. And it should not happen in future. There is also a need for training, yeah, the SMME, especially that electronic system, so that they already are aware, so that there is no delay for them to get payment of the work that they have done. It will be wrong if a company collapses because it has provided services and it is not paid. Where there is a work done through DID, I think Mr. Kobo is able to assist going forward like he has responded. But where it is Department of Health, where we are responsible as the committee, we will try by all means to represent you where possible for them to help you. So our aim was for you to raise issues related to supply, and you have raised them and they have listened to you, and I think going forward there will be a big improvement in terms of ensuring that Lena, who are doing work with the department, are catered for in terms of your payments. So this is not the last meeting, this is the first, but it's not the last meeting. We go all over the province Beginning of this month, we were in Tshwane at Ridgeville on another topic. We are coming with another topic, going to another region because we try to spread across 5 regions. When we go to another region, we will go there with litigations. You will be invited. Those who are having time, they will come and attend so that we see how we can deal with this monster which is affecting our department. For today, I think we have achieved the aim of our committee, and I want to thank you, Ke a le leboga, gore you put everything aside. Latla. When we live here, we wish to see department, the acting DDG is here, the CFO is here, and other senior officials. Training must be available, and we will follow up as a committee so that there are various other trainings. I know le raises the issues that are not related to our topic. We do not ignore those. Those who are still having something, you can come and write it down. We will give it to them so that they are also to help. We are not implementers of anything as a committee. We can only suggest certain things to them. So it's them who should be implementing. I'm taking this opportunity to thank the councillor who stayed with us the whole time we've been here, and we were welcome. We thank you, Councillor Shongwe. I want to thank the office of the MEC also for coming to give you responses through herself and the senior officials that are here. We thank you for coming to this meeting. So we are going to be problematic to you. The time to sit in the office and write you messages has ended. We are going to meet all the time in this kind of meetings. And yourselves, we thank you for coming to this meeting and raise your issues. We thank you very much. We thank you also, those who are doing interpretation, those who are also doing sign language, and everyone who, and also the committee I'm working with, and also the coordinators and the support staff. I thank you very much. We're going to go around and ensure that we interact with our people through all these platforms. And thank you to Inkosi, who came to grace our meeting. We're looking forward to work with Baseb Kosini going forward. It's not the end of the road. We thank you, and I think you must just relax and sit down. You are going to be given something to eat. Don't move, so that when they bring something, they find you next to your chair. Otherwise, if you're going to go up and down, it may cause chaos. Thank you very much. You must drive safely to your respective homes. Fedit.